Are you preparing for an NHS Housekeeper interview? Do you want to know the most common questions and the best way to answer them? In this video, I'll walk you through key NHS Housekeeper interview questions and provide sample answers to help you stand out. Whether you're applying for your first NHS housekeeping job or looking to improve your interview skills, this video will give you the confidence you need to pass your interview and secure the job. Let's get started. 1. Can you tell us about your experience in housekeeping or cleaning roles? In my previous role as a housekeeper, I was responsible for maintaining cleanliness and hygiene in a fast-paced healthcare environment. My duties included cleaning patient rooms, sanitizing high-touch surfaces, disposing of waste properly, and ensuring all areas met infection control standards. I worked closely with nursing and clinical staff to ensure a safe and comfortable environment for patients, staff, and visitors. I have experience using various cleaning chemicals and equipment, always adhering to health and safety regulations. Additionally, I followed strict protocols for handling hazardous materials and ensured compliance with infection prevention guidelines. Beyond technical cleaning skills, I take pride in my attention to detail and commitment to maintaining a welcoming and sanitary space. I understand the importance of a clean environment in a healthcare setting, as it directly contributes to patient safety and recovery. My ability to work efficiently, follow schedules, and adapt to different cleaning needs makes me well suited for this role. I am also a strong team player who communicates well with colleagues to ensure that all tasks are completed effectively. My experience has taught me the importance of working with care and respect, particularly when cleaning occupied patient areas. I am eager to bring my skills and dedication to the NHS housekeeping team to help maintain a high standard of cleanliness and hygiene. 2. Why do you want to work as an NHS housekeeper? I am eager to work as an NHS housekeeper because I am passionate about maintaining a clean, safe, and hygienic environment in healthcare settings. I understand that cleanliness plays a crucial role in infection control, patient safety, and overall well-being. By ensuring that hospital areas are spotless and well organized, I can contribute to the comfort and recovery of patients while supporting healthcare professionals in their roles. In my previous roles, I have gained experience in maintaining high standards of cleanliness, following strict hygiene protocols, and working efficiently in fast-paced environments. I am meticulous in my work, ensuring that all areas, including patient rooms, waiting areas, and clinical spaces, are clean to the highest standard. I am also familiar with using cleaning equipment and chemicals safely, adhering to infection control procedures, and complying with health and safety regulations. Beyond my technical skills, I take pride in being a reliable and dedicated team member. I understand that teamwork is essential in a hospital setting, and I am always willing to support colleagues to maintain a safe and pleasant environment. I also have strong communication skills and a compassionate nature, which enables me to interact respectfully with patients, visitors, and staff. Working for the NHS would allow me to apply my skills in a meaningful way, ensuring that patients receive care in a clean and safe environment. I am eager to contribute to the NHS's commitment to high-quality healthcare and would be proud to be part of such an essential service. 3. How would you ensure that hospital cleaning standards are met? To ensure that hospital cleaning standards are met, I would strictly follow NHS cleaning protocols and infection control guidelines. To maintain a safe and hygienic environment for patients, staff, and visitors, I would begin by carefully following the hospital's cleaning schedules and checklists, ensuring that all areas, including patient rooms, operating theaters, waiting areas, and high-touch surfaces, are cleaned and disinfected regularly. I would pay special attention to infection-prone areas, using appropriate cleaning agents and disinfectants as per NHS policies. I would also practice proper waste disposal techniques, ensuring that clinical and non-clinical waste is separated and disposed of safely to prevent contamination and cross-infection. Additionally, I would adhere to personal protective equipment (PPE) guidelines, such as wearing gloves, aprons, and masks when necessary, to protect myself and others. Regular communication with nursing and infection control teams would be essential to identify any urgent cleaning needs or infection outbreaks that require immediate attention. If I notice any cleaning hazards, such as spillages or broken equipment, I would report them promptly and take necessary action to maintain a safe environment. Lastly, would continuously seek to improve my knowledge of hospital hygiene standards by attending training sessions and staying updated on NHS cleaning policies. My goal would be to contribute to a clean, safe, and comfortable hospital setting that supports patient recovery and well-being. Before we proceed further in this video, if you're preparing for an NHS Housekeeper interview, I've got something that can truly help you feel confident and prepared. I've created an ebook titled NHS Housekeeper Interview Questions and Answers, and it's packed with everything you need to succeed. You'll get 50 real NHS interview questions tailored specifically for housekeeper roles. Model answers that show professionalism, reliability, and your understanding of infection control and patient care. Plus, practical examples that align with NHS values. And the best part? It's available at a 50% discount for a limited time. Simply click the sealer or fourth wall link in the description below to download your copy instantly. Need help? Chat with us on WhatsApp or email us. Don't wait until the last minute. Get your copy today and walk into your NHS Housekeeper interview ready to impress. Now, let's get back to the rest of the video. More helpful interview tips are coming up next. 4. How do you handle working under pressure in a fast-paced healthcare environment? Working under pressure in a fast-paced healthcare environment requires strong organizational skills, adaptability, and the ability to remain calm and focused. I prioritize tasks effectively by assessing urgent needs while ensuring that all responsibilities are completed efficiently. For example, in my previous role, I often had to manage multiple cleaning and housekeeping duties while ensuring infection control standards were met. During particularly busy periods, such as during patient admissions or emergencies, I stayed composed by following a structured approach addressing the most critical areas first, while maintaining a high standard of cleanliness and hygiene. I also rely on teamwork and communication to handle pressure effectively. If necessary, I coordinate with colleagues to divide tasks efficiently, ensuring that all areas of the facility remain clean and well maintained. Additionally, I manage stress by staying focused on my role's purpose, creating a safe and hygienic environment for patients, staff, and visitors. By maintaining a positive attitude and working efficiently under pressure, I contribute to a well-functioning healthcare environment. 5. What steps would you take to prevent cross-contamination and maintain hygiene? Preventing cross-contamination and maintaining hygiene are critical responsibilities in an NHS housekeeping role. To ensure a safe and clean environment, I would follow these key steps. First, I would strictly adhere to NHS infection control policies and cleaning protocols. This includes using the correct cleaning agents for different surfaces, following color-coded cleaning systems to prevent cross-contamination between areas such as patient rooms, bathrooms, and food preparation zones. Second, I would always wear the appropriate personal protective equipment (PPE), such as gloves and aprons, and change them between tasks to prevent the spread of bacteria and viruses. Additionally, I would practice proper hand hygiene by washing and sanitizing my hands before and after handling cleaning equipment or touching different surfaces. Third, I would ensure that high-touch areas such as door handles, light switches, bed rails, and medical equipment are frequently disinfected, as these are common sources of contamination. I would also follow waste disposal guidelines, ensuring that hazardous and clinical waste is properly segregated and disposed of according to NHS regulations. Fourth, I would pay close attention to laundry management, ensuring that soiled linens are handled separately from clean ones and transported in designated bags to minimize the risk of contamination. Lastly, I would stay up to date with training on infection prevention and control to continuously improve my knowledge and ensure that I am following the latest best practices in maintaining a hygienic healthcare environment. 6. How would you deal with a situation where a patient's family complains about cleanliness? If a patient's family raised a concern about cleanliness, I would handle the situation professionally, ensuring their concerns are addressed while maintaining NHS standards. First, I would listen attentively to their complaint, showing empathy and understanding. I would acknowledge their concerns and reassure them that maintaining a clean and safe environment is a top priority. If the issue is something I can resolve immediately, such as cleaning a specific area, I would take action right away. If the concern requires further attention, I would report it to the appropriate staff, such as the supervisor or infection control team, following NHS policies and procedures. I would also ensure that the family is updated on the steps being taken to resolve the issue. Throughout the process, I would remain calm, professional, and respectful, ensuring that the patient and their family feel heard and valued. By handling the situation proactively and efficiently, I would contribute to maintaining a high standard of cleanliness and patient satisfaction within the hospital. 7. Can you give an example of when you had to follow strict health and safety regulations? In my previous role as a housekeeper in a healthcare setting, I was responsible for maintaining high standards of cleanliness and adhering to strict health and safety regulations to prevent infections and ensure a safe environment for patients, staff, and visitors. One particular instance that stands out was during an outbreak of a contagious illness in the facility. During this time, we had to follow strict infection control protocols, including enhanced cleaning procedures, the correct use of personal protective equipment (PPE), and proper waste disposal methods. I ensured that high-touch areas such as door handles, bed rails, and communal surfaces were disinfected frequently using hospital-grade cleaning agents. Additionally, carefully followed color-coded cleaning guidelines to prevent cross-contamination between different areas such as patient rooms, bathrooms, and food service areas. I also adhered to COSH control of substances hazardous to health regulations when handling cleaning chemicals, ensuring they were used and stored correctly to minimize risk. To maintain compliance, I documented cleaning schedules and reported any issues, such as spillages or maintenance concerns, immediately to the appropriate team. By strictly following health and safety guidelines, I contributed to reducing the risk of infection and maintaining a safe, hygienic environment. This experience reinforced my commitment to upholding high standards in housekeeping, ensuring that all cleaning procedures align with NHS regulations to protect both patients and staff. 8. How do you prioritize your cleaning tasks when working in a busy hospital setting? In a busy hospital setting, prioritizing cleaning tasks effectively is essential to maintaining a safe and hygienic environment for patients, staff, and visitors. I follow a structured approach to ensure that all areas are cleaned efficiently while responding to urgent needs. First, I always adhere to the hospital's cleaning schedules and infection control protocols, ensuring that high-risk areas such as patient rooms, operating theaters, and emergency departments receive priority attention. I focus on frequently touched surfaces like door handles, bed rails, and equipment to minimize the risk of infection. Second, I assess the immediate needs of the hospital environment. For example, if a spill occurs in a corridor or a patient room requires urgent deep cleaning, I address those situations promptly to maintain safety and hygiene. I also communicate effectively with the healthcare team to identify areas requiring urgent attention. Third, I work systematically, dividing tasks into sections to ensure no area is overlooked. I use checklists to track completed tasks and remain organized throughout my shift. Additionally, I ensure that cleaning supplies are well stocked so that I can work efficiently without unnecessary delays. Lastly, remain adaptable and flexible. Hospitals can be unpredictable, so I am always prepared to adjust my priorities based on emergencies or staff requests, while ensuring that routine cleaning tasks are still completed. My goal is to maintain a clean, safe, and welcoming environment for all hospital users. 9. What would you do if you found a hazardous spill in a patient area? If I found a hazardous spill in a patient area, my first priority would be to ensure the safety of patients, staff, and visitors. I would follow NHS health and safety protocols by immediately restricting access to the affected area to prevent accidents. If the spill posed an immediate danger, such as a chemical or biohazardous substance, I would report it to the appropriate department, such as infection control or facilities management, for proper handling. If it was a spill I was trained to clean, I would wear the necessary personal protective equipment (PPE) and use the correct cleaning agents as per NHS guidelines to safely remove the spill. After cleaning, I would ensure that the area was properly disinfected and dried to prevent slips or contamination. Finally, I would document the incident and report it to my supervisor to ensure all safety measures were followed and to prevent similar occurrences in the future. 10. Why should we hire you for this NHS housekeeper role? I believe I am an excellent candidate for this NHS housekeeper role because I have the skills, experience, and dedication necessary to maintain a clean, safe, and hygienic healthcare environment. In my previous roles, I have demonstrated a strong understanding of infection control, waste management, and health and safety regulations, all of which are critical in a hospital setting. I take great pride in my ability to ensure that patient rooms, public areas, and clinical spaces are clean to the highest standards, contributing to a safe and comfortable experience for patients, staff, and visitors. I am detail-oriented, efficient, and able to work independently while also collaborating effectively as part of a team. Additionally, I understand the importance of confidentiality and professionalism when working in a healthcare environment. I always strive to be respectful, courteous, and compassionate when interacting with patients, their families, and NHS staff. My strong work ethic, reliability, and commitment to maintaining a high standard of cleanliness make me a valuable addition to your team. I am eager to bring my skills and dedication to NHS Scotland and contribute to the smooth running of your healthcare facility. Do you have any question for us? Here are 5 strong questions you could ask at the end of your NHS Housekeeper interview. 1. Can you tell me more about the housekeeping team and how this role fits within the wider NHS Scotland team? 2. What are the biggest challenges in maintaining cleanliness and infection control in this hospital? And how does the housekeeping team contribute to overcoming them? 3. Are there opportunities for additional training or career progression within the NHS for housekeeping staff? 4. How do you ensure that the housekeeping team stays updated on the latest infection prevention and health and safety procedures? 5. What are the next steps in the recruitment process, and when can I expect to hear feedback on my application? These questions show your enthusiasm for the role, your commitment to high hygiene standards, and your interest in growing within the NHS. Now, you know the top NHS housekeeper interview questions and how to answer them effectively. Remember to highlight your cleaning skills, attention to detail, and ability to work in a healthcare environment. Don't forget to research NHS values, use the STAR method when answering questions, and show your enthusiasm for the role. If you found this video helpful, please like, share, and subscribe for more interview tips. Good luck with your NHS housekeeper interview. I'm rooting for you.